Hi, I'm Brad Briner, your state treasurer. The state health plan premium rates for 2026 have now been set. The final vote on premiums by the Board of Trustees took place just moments ago. So I want to speak directly to our 750,000 state health plan members about today's action and why we needed to do this. But first, I'd like to reiterate to you how much we value your service and commitment to the state, which is why keeping the health plan viable has been my first priority since I took office in January. We've been as transparent as possible about the crisis situation my team was left to clean up. Simply put, we are here because of the short-sighted decisions made in the past. Premiums were frozen for years, and state employees were made to believe that they would be that way forever. But we were actually spending more than we were taking in the whole time. That meant the cash reserves for the plan were being used to keep prices stable, rather than actually doing the hard work with providers and making adjustments to provide better service at lower prices for our members. Now, those reserves are nearly gone. On top of that, benefits like the GLP-1 weight loss drugs were cut last year, and one-time money was raided to keep the health plan afloat. When I came into office, the plan was facing a staggering $507 million deficit in 2026 and an additional $1 billion in 2027. This didn't have to be this bad, but we play the hand we're dealt. And the team here at the department did just that. We used a three-prong approach to plug this hole. We started with the legislature, asking that it find an additional $150 million for the plan. That's a big ask in a year, but a huge ask in a year where there are Helene needs for so many people in our state. The General Assembly came through and did its part and has already approved that money for you. Next, we went to providers, the doctors and the healthcare systems across the state, and made a very difficult ask. Continue your current level of coverage, but do it for less money. Listen, it isn't ever easy to ask people to take less, but our team here in the State Health Plan Division have done remarkable work. They have been in a full court press since January, and as we sit here today, we're walking away with a W in that column. It cannot be understated the effort it took to get those agreements with providers changed. Just a few minutes ago, we took the final step. The Board of Trustees voted to increase premiums. In 2026, most of you will have higher premiums. It is not ideal. We know that. But it's necessary to keep the plan afloat. The email that came with this video breaks down how much you will pay each month based on your salary. For our active members, I want to remind you, premiums aren't the only thing you need to pay attention to today. We are also working to focus on better care at better rates. We've told you about our partnership with Lantern, where surgeons are being fully vetted and ranked as the top providers in the state, and then we are letting that select group bid to get most of your business. That means full operating rooms for them and $0 out of pockets for you. You heard that right. No cost to you. Also new, and this will start in 2026, is our Preferred Providers Program. These doctors and healthcare practices have been identified as being committed to improving access to high-quality, affordable healthcare. When you see one of these providers, you will only pay the lowest copay for an office visit. For our Medicare Advantage members watching this, note that your premium structure changes are different than the active members. That chart is also in the email this message was attached to. The mission of the State Health Plan Board of Trustees and my mission as the state treasurer has been to safeguard the future of your benefits. We're committed to transparency. We're committed to fair partnerships with providers. And we are committed to listening to your feedback. Please continue to reach out and ask questions whenever you have them. Thank you again for your service to our state and for your understanding as we navigate these necessary changes together.